We are so delighted to welcome Professor Lisa Bayliss-Pratt. So could you please give us an introduction of yourself?
Yes. Oh gosh, it's a real pleasure to be doing this piece of work with yourself, which is a brilliant piece of work that raises the profile of nurses. And I myself have been a nurse all my adult life. I started training to be a nurse at Coventry University at the age of 18. I've worked in the private sector, the public sector in England. I've also worked at the regional level and at national level, influencing policy and practice and really trying to develop the nursing workforce. And most recently, I've been leading this global activity, which I have to say, has been one of the most joyous things that I've done today. Delighted to be the programme director for the Nursing Now Nightingale Challenge. And really, the Nursing Now Nightingale Challenge has been a fantastic initiative to raise the status and the profile of early career nurses and midwives all over the world. I'm delighted to say that we've networked over 30,000 early career nurses and midwives in over 89 countries, and the network is going strong. As of June this year, we'll be evolving the Nightingale Challenge into the Nursing Now Challenge, and our ambition is to be able to have at least 100,000 nurses and midwives that are early in their careers, networked, learning, sharing, and really becoming a powerhouse and a force for change for our nursing profession globally.
Thank you so much for sharing your experience. From this current pandemic, like nurses are struggling globally and they're having a really hard time. Then from Nursing Now project, how could we support nurses leverage their leadership? Do you have any thoughts?
Absolutely. Well, when the pandemic hit, basically this time last year, wasn't it, around for many of us, it really kind of threw up in the air all of the plans we had, because of 2020 was going to be this fantastic year for nurses all over the world. It was the year of the nurse and the midwife. We got the Nightingale Challenge. We got the fantastic social movement of the whole Nursing Now programme that Lord Crispard spearheaded. And this was all going to be lots of celebrations, lots of sharing, and then COVID hit. And I was really thinking, oh my goodness, what will happen to all of this great work? But, surprisingly, or perhaps unsurprisingly, given how robust the global nursing workforce is, we continue to come together. The Nightingale Challenge participants, although some of them had to delay their leadership programmes, they got back on board with them. And throughout the year, to support COVID and all of the issues, we were able to provide some thought leadership, some webinars to support the nurses. And I think what it's done is it's really brought into focus the need to focus on the health and well-being of the health workforce, not just nurses actually, but all health workers. And I'm particularly passionate about the mental health and well-being of frontline nurses, midwives and others. And we've put quite a lot of energy into finding ways to support people through these really difficult times. But not only that, I think, the world has seen the value of nurses and nursing. It's seen the importance of public health and prevention. And we're also seeing lots of evidence about the research that's needed and the role that actually we all play in trying to keep ourselves healthy. But nurses are one of the most trusted professions in the world. They're the go-to place for lots of healthcare. And therefore, I think the nursing workforce globally will come out of this pandemic stronger in many ways in terms of its perception, its priority, and the urgency to invest in it than it ever has done. So, as you would expect with the fantastic profession of nursing, many have turned this into a platform to demonstrate their value, their contribution, and indeed what they need moving forward in order to provide more and better health for everybody.
Wow, thank you. Then from a Nursing Now perspective, what are your future goals or future visions? Do you have any thoughts?
Oh my goodness, absolutely. I mean, my absolute vision for the future of the Nursing Now Challenge is that it truly becomes a global network place that all early career nurses and midwives can go to, that it becomes that thought leadership space where early career nurses and midwives can test out their ideas, they can put things forward, they can influence policymakers, they can actually be part of this bigger contribution to providing more and better healthcare for everybody. So I'm really excited and incredibly privileged to be taking forward the Nightingale Challenge as of June, where we're going to rebrand it the Nursing Now Challenge. And we're going to take all of those lessons from the Nightingale Challenge and the Year of the Nurse and the Midwife and really build on it with, we hope to create exciting partnerships, to generate funds, to be able to support early career nurses and midwives to secure funding to do particular activities, but most important for them to feel part of this global community where they really, really do make a difference. So, my job is to facilitate and to empower these early career nurses and midwives to be the best they possibly can and be fearless in their passion and tenacity for delivering great healthcare to everybody.
Wow, that's so incredible. Like, yeah, as a nurse, I'm a nurse myself, but
Fantastic.
yes, I really felt like there's like a real community. Like
Yeah.
sometimes we feel really isolated working alone or like struggling with this current situation, but I think this is something that everyone really wanted to have. So I really appreciate for Nursing Now's project and leading us globally. So I'm so happy that this can be part of the project. Finally, could you give us a message to nurses and nursing students who will become the future leaders in the society?
Oh, there's so many messages, isn't there, that can be wound up. I mean, I suppose first and foremost, I want to say that, speaking from the heart, becoming a nurse is the best thing I've ever done in my life. There are so many opportunities. We are bigger than we realise. We are hugely connected and we can make a massive difference to the lives of others. So please keep the passion. Never forget why you wanted to be a nurse and always hold true the values of nursing, because if you hold them close to you, then you will not only do a great job, but you will make a massive difference.